Hello, I'm Phoebe Norton, the retired Executive Director of the Mental Health Center serving Boulder and Broomfield counties in Colorado, now called Mental Health Partners. This Caring Clergy video gives you some guidelines for deciding if one of your congregants needs to be referred to a mental health professional for help with a mental health issue. Most people will recognize they are facing a troublesome emotional issue. Some will seek outside help, either from you or your clergy colleagues or directly from a mental health professional. Others will not want to seek help for various reasons. Some may choose to work on the issue themselves. They may lack appreciation for the magnitude of the problem, or they may be embarrassed or be concerned about the cost of services. You may encounter congregants who do not recognize they have a mental health problem, though it may be obvious to their friends and families. Some people with mental health issues attribute their difficulties to others or to outside circumstances. To help these individuals, you will need first to establish a trusting relationship with them. Deciding whether a congregant needs to be referred is a matter of judgment. To make a good call, you will need to assess many factors, but they fall into three broad categories: level of distress, level of functioning, and the possibility of danger. First, assess your congregant's level of distress. How much distress, discomfort, pain, or anguish are they feeling? Equally important is what is their ability to tolerate, manage, or cope with their distress. If they are losing ground, feeling overwhelmed, or becoming symptomatic, they are likely to need professional help. Next, assess their level of functioning. Is the person capable of caring for him or herself? Are they eating and sleeping adequately? Are they able to use organizational and problem-solving skills to address the issues they face? If not, professional help is recommended. Consider the possibility of danger. It is important to assess the possibility of danger to your congregant or to others. Danger can be intended, for example, when someone has a plan to commit suicide or harm a boss who has fired them, or danger can be unintended, for example, when a person is manic and follows through on impulses without regard to consequences. Whether the possibility for danger is intended or not, if danger is a real possibility, professional help is critical. You may be wondering if it is a criminal or a mental health issue, but you can leave that decision to the mental health professional to make after they have conducted an evaluation. The level of urgency will vary. If you believe the danger is imminent, call 911 or your area's mental health crisis response team immediately. More often, you will face situations where the danger is just a possibility if the situation does not improve. It is still important to get professional help. We've talked about the three broad categories of factors you need to assess before you decide whether to refer your congregant to a mental health professional. But you may need to also take outside factors into consideration, such as information provided by friends and family members, medical problems, and drug or alcohol abuse. Also, consider life stresses such as death of a loved one, financial trouble, moving to a new home, job loss, or loss of a relationship. These situations can arise for anyone, but the key is to evaluate how they are affecting your congregant and how well he or she is coping with them. After evaluating your congregant, if you are still not sure if he or she needs to be referred, you might consider calling a mental health professional and asking for advice. Different clergy members have different levels of comfort and confidence dealing with the mental health issues of their congregants. If you feel uncomfortable with any of the areas of behavior we have discussed in this video, by all means, refer your congregant to a mental health professional. Be sure to see the other videos in this series about how to develop a list of referrals resources and tips for making good referrals. Remember, You are an important link to helping your congregants get the mental health care they need. Thank you for caring.